I'll tell you that story.
Okay.
I will tell you that story.
Okay, I'm on camera now. We are so, if you can't tell, we're so excited to have this many people here at one time. Every lecture we have is so good. And I want to give a big shout out to our two biggest fans for the lecture, Jim and Lori. Because unless Jim is with the grandbaby, they're both up here at every lecture. So they never miss it, and they can tell you that every one we've had has been so good. And Kenneth is right behind them because he's up here nearly every time too. So we just think this is a great, we have such a wonderful library here in Kennedale. And the library has so many things for kids. And this is something we thought would be a great event for adults. And so we had the worst time getting the word out about it, or trying to figure out, would it be better at night, would it be better on a weekend? And so it works out for us to have it here because we can have our meeting each month right before we have it. And so we just decided we'd just try to keep building it, so we're hoping the word will get out. Lori is a wonderful speaker. She is in the Rotary with me and Joe and Stephanie and Wendy. She is a doctor. She works in, well, she'll tell you about that. But she is really a wonderful speaker. And she's done several different talks. She did one on polio, she did one on vaccinations and immunizations. So she spoke for us before, and it's going to be really good tonight because it's such an interesting topic. And next month, I'll just prepare you right now, we're going to have Mrs. Vicki Bryant from Arlington. She is the historian for the Top of the Hill Terrace over there on Lancaster that used to be the speakeasy, the place where the gangsters went. Movie stars came from all over the place. They built a basement down under, they moved the whole restaurant, built this underground thing, put the restaurant back on top of it, built tunnels going out of it so that when the police came to raid them, because it was during Prohibition, that they could escape and be out in the tea garden having a cup of tea when the police got there. And she's got the greatest stories. She's got historical artifacts to show, and she's spoken before for us before and for Rotary before. And she's really, really good. So next month, plan on coming. It's always on the third Thursday, except for last month we had to move it. But third Thursday, and it's going to be over here again. I'm sorry, darling. It's going to be over here again, but we usually do it in the library. So mark your calendars and invite your friends because it's going to be really, really good. So with that being said, take it away, Dr. Lori.
And I've heard Vicki speak before. It's really awesome. I gotta get out of the light here. She's really good. So if you haven't heard her talk about the Top of the Hill, you really ought to come. It's very entertaining, to say the least. Well, I don't really know that I need to make a huge introduction because my topic isn't exactly what I do. Unlike the last couple of lecturers, I'm not a historian. I am a family physician by training, and I've done all kinds of different things. I've been in the Air Force as a flight surgeon. I've practiced. I've run medical groups. I have been an insurance company medical director, so I've done a lot of things. But I've always had an interest in history. My father was a history major, and he instilled in us the value of history. And then I've always been interested in the history of medicine. So this comes out of my sort of hobby, I guess, reading about historical figures. And then actually, my interest in this topic came when my dear husband gave me a book that is fascinating. It's called The Butchering Art, and it really is the story of James Lister. So if anybody wants to read more on the topic, I highly recommend that book. And if you go to Wikipedia and you look for for Dr. James Lister, James, I don't know,
Joseph.
you're James, yeah, Joseph Lister, sorry. In there, they actually take a lot from this book, and it's footnoted, but you can see. So it is a good resource. Anyway, before we go back to Joseph Lister's time, which is the Victorian era, I want to ask you some questions. This is meant to be interactive, so jump in. The question is, if you are going for surgery today, elective surgery today, what are the things that you assume are going to be in place?
Anesthesiologist,
An anesthesiologist,
a bed,
that's true.
Sanitization,
An operating room, what's that?
everything being sterile.
Everything being sterile, good. Anything else?
competent doctor,
That's always good, a surgeon that's competent.
billing office,
A billing office, well, that wasn't on my list, but yeah, there is always one, yes. Anything else anybody thinks about?
Standard operating procedures.
Which might include,
Making sure you're operating on the right thing.
correct,
Lots of hand washing.
any kind of medications,
Yeah. Painkillers.
antibiotics, that was what I was looking for. The other thing you might think of, depending on what kind of surgery you're having, how extensive it is that there's blood on standby. So, yeah, I mean, because you don't know. So let's see if I forgot anything. Well, the surgical stool, both the operating room and the surgical tools would need to be sterile, correct? Okay. Also, the dressings that they put on your incision would need to be sterile. I mean, you're not wanting them to put gauze pads or whatever kind of pads they put on you that's been sitting out, correct? All right, and you also expect them to wash their hands. Okay. Meaning the surgeon washes his hands, the nurses wash their hands. All right. So we're going to go back in our little time capsule to the 19th century. One of the things is that they tried not to do surgery. The surgeons tried not to do surgery because, first of all, they didn't always know what was wrong with you. They didn't have a way to look inside you, if it was in your belly. There were no x-rays till 1895 when they started realizing that they could actually see inside. But they didn't always know what was wrong with you. And if they did, they might not want to do surgery for the reasons that if they went into your belly, you didn't have a high chance of surviving because of infection, okay? Their operating rooms were not at all sterile. They didn't know what sterile meant. Very difficult if you don't understand germs. They didn't know about germs. So their tools weren't sterile. They did have anesthesia starting about 1840s. So there was some anesthesia halfway through. They had chloroform, they had ether. Chloroform was preferred, actually, but they did also use ether. Antibiotics hadn't been invented, so they didn't use antibiotics on anything or anybody. They did really understand that maybe giving people blood when they lost a lot of blood might work, but blood groups, like O positive, all that stuff, that didn't come about until 1901 when an Austrian scientist discovered them. So they tried transfusing people with other people's blood and even animal blood. Actually, sometimes it worked, but they had no idea why it did, And most often it didn't work, so, yeah, so that was not really helpful. Their dressings were not sterile at all, and they never thought about washing their hands. That was just not a thing. So, now the 1840s, I mentioned that surgery was supposed to be avoided. One of the things that they talked about was the good old hospital stink, because there was so much infection in the hospital and it smelled. And I don't know if you've ever had infection yourself or you've been around anybody who's had something badly infected, but there is a smell to it. And you could imagine wards full of people with infection, it's going to smell. But they viewed pus as essential to the healing process. They had no idea that it was really not intended to go that way. You actually could have surgery at home if you had a lot of money. And that was safer because they had clean instruments that they brought. Whereas in the hospital, they went from one case to the next with the same instruments, and they didn't even wash them, let alone sterilize them, because they didn't know what sterile meant. They didn't know how to sterilize. As far as their anesthesia, like I said, in the 1840s, they developed anesthesia. Mesmerism was still talked about. There was a guy who was touting that, and back in the 18th century, there had been a guy whose last name was Mesmer, and that's where we get mesmerism from. And he thought that all you had to do was like hypnotize people, and they wouldn't feel the pain. That was his solution to pain management.
What about those old movies where they have them drink whiskey before they take the bullet?
Yeah, they use alcohol. They used to use opium.
Oh.
They had Native American, back here, we had Native American solutions and things that were used. But as far as like ether and chloroform where you're actually put to sleep, not so much. Yeah. So probably the first person to use anesthesia was actually here in the States. He actually didn't document it though for 6 years, and so he didn't get the credit for it initially. It was a dentist in Boston who demonstrated, and it was highly touted, that he actually could pull teeth and somebody could be asleep while he did that, which was unusual. I think those people probably had whiskey normally for their teeth extractions. But the one that was important to our story is Dr. Robert Liston. Dr. Robert Liston was a surgeon in London who was 6'2", which is probably about 8 inches taller than the average British person, either then or now, who was known for very rapid amputations. His amputations was the main way that you dealt with infection in a limb. Because they didn't have antibiotics when they started turning gangrenous, they realized that either the patient was going to die or they were going to have to try and chop off the limb. But in the days before anesthesia, they had nothing really. So you had to be fast. And he could do amputations in a minute or two. He actually was his own tourniquet. He would take his arm and cut off the circulation and chop it. There's some apocryphal stories about this gentleman, but he did that. So he decided, he'd heard about this anesthesia thing that was in the colonies, so to speak, and he decided he was going to try the Yankee Dodge. That's what he called it. So he had, back in those days, when you were a surgeon, you had operating theaters which were really like theaters. I mean, you had the patient in the middle, and you attended them as the surgeon, but then you had sort of stadium seating and people would watch. Students would watch, anybody could watch, sometimes people off the street would watch. So it was really an operating theater. And so he had this operating theater filled to the max with all these people to watch him use ether on this patient. And it was very successful because the patient woke up after the amputation wanting to know when the surgery was going to start. So he didn't feel it. And he declared that the Yankee Dodge was better than mesmerism. So, that was at least something. And after that, because he was so prominent, the surgeons started using that more and more. In the audience for this was Dr. Joseph Lister. So that made an impression on him, obviously. He was not a doctor then, he was still in school, he was in medical school. The problem with more surgeries was you got more infections, because the surgeon said, oh, well, I don't have to worry about strapping this patient down, because that's what they had to do. They had to strap them to the table, because otherwise they're flailing all over because it was so painful. So since I don't have to do that, I can do this, I can do more surgeries. But the problem is, they still didn't know that pus was not normal, what caused pus, how to keep it from happening. So that was a major issue for them. Okay.
Oh, no, I'm sorry, scratching my.
Oh, okay, I thought you had a question. So that was still a problem. Now, there are three key people in this story. We're obviously going to talk about Joseph Lister, so I'm not going to start with him, but everybody's heard of Louis Pasteur, partly because his name has been immortalized in pasteurization. So if you didn't learn about him in school, you've at least heard that. Louis Pasteur was a scientist. He was a French scientist who dabbled in chemistry and pharmacy and microbiology, and he would be, because he was so bright, he would be asked to do things like, tell me why my wine hasn't fermented properly and it tastes sour. So he would do studies on various things like that. He had all kinds of projects he worked on. And one of the things that he did in this process was particularly related to the wine, was to prove that you didn't have spontaneous generation, because what the scientists thought prior to this was that bugs just started growing, or whatever it was, just started happening, and they called it spontaneous generation. It just happened. But he proved through a series of experiments by taking beakers or test tubes or things that he could put solutions in, and then some he put tops on and some he didn't put tops on. He proved that the ones that didn't have tops on them grew things in them, and the ones that did have tops on didn't grow anything. So and that was really revolutionary. So this was something that he continued to work on, to continue to perfect, to continue to try to understand the whole concept of fermentation. He worked on silkworm disease because he was asked to do that, chicken cholera, anthrax, trying to understand how it all worked. He's considered to be one of the fathers of the germ theory. And he's the one that recognized that heat would kill bacteria. That's where you get the pasteurization from, okay? Now, Robert Koch is a couple decades younger but they had some overlap. He was German, he was a physician, he was a microbiologist. And if you've ever taken a microbiology course, you know that he was responsible for Koch's postulates, and that is, okay, there's a disease, this animal has a disease, we take this, we grow that bug out onto a petri dish. Petri was his assistant, so that's how it got named petri dish. Yeah, that's where the name came from. And then that can go into a healthy animal and causes the same disease. There's like 4 postulates that he developed. He actually worked on anthrax, tuberculosis, and cholera, and other things. But he actually proved that there were different bacteria that caused different diseases, which is not something that they knew before. Because before it was like, well, it must be in the air. Miasma, they called it, is causing people to get sick. So Joseph Lister didn't know anything about these bacteria. He didn't know anything about the different diseases being caused by it, but what he did do was take Louis Pasteur's work and apply it to sterilization, because what he realized, and I'll get to that in a few minutes, that Louis Pasteur had a concept for how to kill disease, bugs. Joseph Lister. So now we're going to talk about him. He was born, as you can see, in 1827. He actually was from a prominent Quaker family, a prosperous Quaker family. His father was a wine merchant. I actually did not know Quakers did wine, but apparently, initially they did. But he was also called a gentleman. His father was called a gentleman scientist. And what that means in this case is that for some reason he was very interested in microscopes and lenses, and he actually came up with a better way to do lenses, and was well known among people who were microscopists who needed microscopes and knew the calculations for how to do those lenses. And he actually became a fellow of the Royal Society, which is quite a big deal. So he wasn't just a wine merchant. His mother actually worked in a Quaker school for the poor. Her mother was the principal there. Like everybody in those days, they had a lot of kids, but some of them always died. So they had their story with that too. So Joseph Lister was homeschooled till he was about 11. He stuttered. So he was kept at home and he was homeschooled. His home, though, was rather unique in that it had a museum of sorts. His father was very into nature and things you can find in nature. So they had a museum, and they had a large library that consisted of religious books, because they were Quaker, and science. So he had a lot of education just being at home. For some reason, he decided he wanted to be a surgeon at a very young age. This was not the norm. People didn't decide this. It was actually not thought of as a very great occupation. Just like the century before, it was really more butchers, the butcher surgeon. Barber surgeon, sorry. Well, a butcher too, but barber surgeon, they didn't have much training. And they didn't make a lot of money back in those days. So he started on his track to go to school. He went to University College London when he was 17. And then he had to get a bachelor's, which not all medical schools required that, but he had to. And then somewhere in there, his brother died. He himself had a case of smallpox, and it was mild for him, but his older brother died of smallpox. So that's one of the things back in those days that you never knew when those things were going to hit you. He went through a grief process, so he took off about a year and a half in between. But he then went back, went to medical school. He had, as a second-year medical student, he actually did an abdominal surgery. A woman who had been stabbed by her husband. And, you know, like I said, back in those days, they didn't do abdominal surgery, but she was going to die without it if he didn't do surgery. And she wound up surviving, and he wound up going to court to document for the court what her injuries were. So that was interesting. Anyway, he graduated with honors. He published papers while he was in training, while he was in medical school. He had the best microscope in school, which you can imagine because of his father, but he used that microscope. He looked at everything. If somebody had tissue in a surgery, he would take that tissue and look at it and try to understand what that meant for that organ system. So that allowed him to become very adept at microscopy, and also he wrote papers about different things. And he continued to do that really throughout his life. Okay, so he graduated. He's now a fully graduated medical doctor. He decided to go to Edinburgh, Scotland, which had a very, very good training process up there for surgeons. Unlike London, where it was more academic and less hands-on, in Edinburgh, it was hands-on under a mentor, which is a lot like surgery is now for us, where you go and you do a residency and you work underneath surgeons. See one, do one, teach one kind of concept. That's the way it was for him. He managed to become what they call the supernumerary house surgeon under Dr. James Syme. Now, Dr. Syme is actually important because there's a procedure named after him that we still do to this day. And that procedure is an amputation at the ankle. He perfected that, so it's named after him. I didn't realize that until I read this book. I didn't know who he was, but that's who he was. And he was known to be an excellent surgeon. So Joseph Lister got to be his, basically, extra assistant. And that was a good thing for him because he impressed Dr. Syme. Dr. Syme, therefore, made sure that he got appointed as a lecturer. Now, what happened in that time is that there were two parts to being a surgeon, and you had the education, the lecture for the students, and then you had actual surgery that was the surgery on the patients that came into the hospital, the infirmary. Initially, he didn't have a spot to be the surgeon, so he was assigned all these lectures to give. So he prepared for lectures. His students really liked him. Because of his tendency to stutter, he spoke slowly so that they could keep up with him. And they really liked that. And he was also considered to be very clear and articulate about the subject matter. But then, what happened in here, there was the Crimean War in 1854. So some of the surgeons went off to war, but because he was Quaker, he didn't. So it helped him get a spot to do actual surgery. Then he decided to marry Dr. Syme's daughter, which was probably useful also, but she, in his defense, she was actually a very intelligent woman who did a lot of assisting for him, writing tediously in his books when he was doing experiments. He would dictate her and she would write, and she did that throughout her life with on him. He did have to convert though. She wasn't Quaker, so he couldn't stay a Quaker. Then he got, further and further along in Edinburgh. He had a surgeoncy, which meant he could do everything. He had a team that included students, and he published 11 papers between 1857 and 1859, which is pretty phenomenal. This day and age, you wouldn't be able to do that. So, but all kinds of topics, because he was interested in everything. So inflammation, coagulation, you can see it up there, the pigment of the frog, he just was interested in anything he could put on in the microscope. Then what happened, and how this happened back in those days, is that you got a new position in a different place by somebody dying. So they had a surgeon in Glasgow, the head of the surgery department in Glasgow, which is about 40 miles away, died. And he applied for the position, and he was recommended by Dr. Syme and others, and so he got that position. Now, it was a different place. It's like anytime you change jobs, things are different. It was different, and he had to, in order to be fully accepted, he had to give a speech in Latin. And he was told the day before, so he didn't know, like 3 weeks notice or anything. So he was pretty stressed out about that, as you can imagine, but he actually only did a couple of paragraphs, and they said, oh, you've passed. So he was, one of those things. Anyway, he also had trouble. They only would let him lecture at the beginning because the guy who was on the board, the head of the hospital board there, didn't want, because he wanted to do the same thing where he did surgery, had the medical students with him, all that stuff. This guy, David Smith was his name. He was a shoemaker. He was the head of the hospital board, which that probably wouldn't happen today. He said, no, this is where we cure people. This is not where we educate people. So it took him another 1.5 years to be able to get to where he could actually do surgery and have the students and everything involved. So this is kind of how his life is going. He's surgery. His mother died of an infectious disease. His mother died of erysipelas, which is actually strep. And they had antibiotics. So he saw a lot of erysipelas in his patients. They all knew what it was. They didn't have a way to treat it, unfortunately. So what happens to change all this for him because he's now concerned everywhere he goes, patients are dying of infection. They can do amputations, but 50% of those die of infection. So they're trying to save somebody's life, a gangrenous limb, they die of infection anyway. And this really bothers him. In 1865, while he's here in Glasgow, one of his colleagues says, hey, have you heard about that guy Pasteur? He's put out some papers on what he calls putrefaction. And he knew that, which is partly how you get pus, he knew that that was an issue for Lister because they talked about it. He said, maybe you ought to look at those papers. So he got a hold of those papers, and it was like a whole light bulb clicked on for him. Oh, this is important. And he realized that he needed to figure out a way to really, he didn't use the word, but to sterilize things related to surgery. And he realized Pasteur recommended 3 ways to get rid of the things that cause growth that you don't want in a test tube. You can filter and get rid of those bugs. You can expose them to heat, which is how the pasteurization process works, or you can use chemical solutions. Well, he realized early on that the first two were not going to cut it, that he didn't have a way to do that in the OR. So he started testing solutions. And the first couple that he used didn't really work, but he came upon carbolic acid. Now, carbolic acid is something that was known in the Victorian times. The Victorians had a lot of issues with sewage. I don't know if you've ever really delved into Victorian history, but they had a lot of, they used to dump sewage in the straits. The straits were filthy. The Thames was filthy. The Thames River was filthy. In fact, in 1858, they had the Great Stink, which was where so much sewage and waste from factories, etc., had been dumped into the Thames that the entire Thames stunk. And they had to actually do something about it. Well, carbolic acid was one of the things they used to treat water. They didn't know what it was doing. It was killing the bugs, so reducing the smell, because the smell is from all these bugs growing and producing nastiness. So he started using that. The first couple people he used it on, it didn't exactly work like he wanted. And so he decided that he had to refine his idea of who he would try it on. And he decided that he needed to wait until he got a case of a compound fracture. Now, a compound fracture is a fracture where the bones have broken through the skin. Which in those days had terrible rate of infection and very difficult to keep infection out because you've broken through and, just like this little street that those bugs walk in. So, in 1865, August, he got his first attempt to do this. And it was an 11-year-old who tried to cross the street and got run over by a cart. A horse cart. Well, this poor little guy, took him 3 hours to get to the hospital. And you can imagine, we're not talking about ambulances here. We're talking about, first of all, they had to lift the cart wheel off the guy's, leg. And then they had to figure out how to get him. And of course, the kid's screaming in pain the whole time. They had to figure out how to get him to the hospital. By the time they got him to the hospital, it was even dirtier than it was when he first had it because the streets, dirt, and everything. So he was in a bad way. And this is who he decided to try this on. Which actually was pretty gutsy because most people would have amputated that leg. All right, so compound fractures often resulted in abscesses and stuff like that. Well, he actually was successful. Now, this poor little guy wound up being in the hospital for 6 weeks and 2 days, but he walked out on that leg healed because of the carbolic acid treatment. Now, the carbolic acid treatment wasn't just pouring carbolic acid on it, it was using it in surgery to clean the wound, but also dressings were soaked in the carbolic acid and they were changed periodically. And he realized in the middle of it, he realized that the skin was getting a little bit irritated from the carbolic acid, so he mixed it with olive oil. So he had salad dressing on it, but it worked. So that was the big success. So after that, he tried it on other people. It seemed to work, and he published a paper about this new method for compound fractures, a new method to treat compound fractures. In other words, the old method was amputation. That was 100% what everybody got. This is a new method. Then he started expanding the treatment to other issues, lacerations and things like that. He had really good success with it. He published in The Lancet. The Lancet is a well-known medical journal in Britain, and a lot of people here read it too. His 2 wards that he was in charge of in the hospital became lots healthier, way fewer infections. And he said that after employing the system, not a single instance of pyemia. Pyemia is basically like where you get bacteria in the bloodstream, and then you get abscesses all over from that. Gangrene or erysipelas, which is the strep infection that we talked about. So then what happens is his sister comes to him and says, I have a breast mass and nobody will operate on it. Now, Joseph Lister had never done a mastectomy before, but he felt like with his new process that it would be a good thing that he could try that. She had already gone to 2 other surgeons who said no, they wouldn't do it because it was a large area and they didn't think they could keep it uninfected. So he actually had to read up on how to do mastectomies. He actually got a cadaver and did a mastectomy on a cadaver. And then he did her mastectomy at his house on the dining room table, and it was successful, and she didn't have an infection. Now, she did die 3 years later because, you know, back then they didn't know that it was probably already spread, and she had it in her liver by the time. But she had 3 years, so that was unheard of back then because they wouldn't do surgery on it. Surgeons not doing surgery because of infection. So, you know, that was a big success, actually. And then he delivered another paper to the British Medical Association. So, what happens when you do something new? When you do something new, especially with physicians, they don't like it. They don't like to be told they're wrong or that they killed people doing something wrong. So there were a lot of people who said, this is quackery, this is, you know, hocus pocus, and we don't believe you. You can imagine. I mean, it's true of all people, but there's always a resistance to change to something new if you don't really understand it. And still people didn't all understand the germ theory. So if you don't understand the germ theory, you're not going to understand why you have to do this stuff. He actually wound up going back to Edinburgh not long after this because his father-in-law, Dr. Syme, died. And they asked him to come to be the head of the surgery department. So he did, and he kept going on, and he kept arguing with very famous physicians who said, no, this is just hogwash. But what happens is that each time he went anywhere, the medical students were trained by him. He made them understand what the process was, and the medical students became very clear about what was going on, why he was doing this. And in fact, one of them actually said, you know, he's so articulate about it, and he's so reasoned about it, that you can't even understand why anybody would think that he's wrong. So the medical students got it. First, they hadn't been in the profession as long, so they didn't have all the same baggage. So gradually, we have more and more medical students who understood this. Some of the older physicians thought that since he kept refining his carbolic acid techniques, that meant that he felt like he was wrong, or that it wasn't working. but that's just the way science works, is that if you have something that works and you want to make it better, you fiddle with it. You try to see what else you can do to make it better. He was always very thoughtful about his responses to his critics. He used science. He used his own data to back it up. And he just kept pressing on. Finally, by 1870, the Lancet said, hey, you know, we ought to all give this a try. This might actually work. And in 1871, he actually treated the Queen. So what happens with the Queen is, Queen Victoria we're talking about, Queen Victoria developed a very large abscess in her armpit. Those are very painful, and you would die from that in those days with no antibiotics or no way to do it, and nobody else would touch it, so they called him in because they knew that he was doing them. So he spent a couple of days. He actually, basically what he did was he lanced her and made sure all the pus was drained out and all that, and made sure she was on the way, and cured the Queen, and of course she thought he was wonderful. And he went back to Edinburgh and said, I'm the only person who's ever put a knife in the Queen. So, anyway, he went to London and met Pasteur there when Pasteur came over. They actually became quite good friends, and Pasteur was very excited that Lister was using his germ theory. And the patients actually saw the difference. The patients actually started coming to his defense. And in 1875, he did a tour of Europe. In Europe, they thought he was a genius. Europe, meaning not England, but the other parts. So, how about Americans? How did we deal with this? Well, American doctors aren't any different than any other doctors. They think it's all quackery too. It was very slow for them to understand it. Massachusetts General, which is an old institution and very learned place, banned his techniques. They didn't want to have anything to do with his carbolic acid nonsense. So he decided that he needed to come over and be like the ambassador for his own process. And he did. He came over, left in July of 1876, wound up, there were some storms and stuff, he got a little bit delayed. So by the time he got to, and then he had to go to Philadelphia, the reason he went there was an international medical congress, and he wanted to speak there. So by the time he got there, it was September, but they were still in the throes. If you recognize 1876, Philadelphia, they were still celebrating the 100 years of the Declaration of Independence signing, and he gets off the train and he's met with people hawking souvenirs and all this kind of stuff, and he was like, oh, I'm just here to do my little medical thing. But it was a very busy city at that time when he arrived. He was invited by this guy, Dr. Gross, who was apparently well known at that time, and he didn't believe in any of this stuff. He didn't believe in the germ theory. He didn't think there were any germs. Now, but I want to remind you that we're talking about 1876. The end of the Civil War was 1865. During the Civil War, thousands of people had amputations. Thousands of people died from those amputations. Now, there were people who lived too, but there were lots of people who died from amputations. Because, why? They did one right after the other. I mean, if you go to some of these battlefields, my husband and I went to Antietam years ago, and there's a church there where they basically had a table, and they had the table up at the window, and they have it oriented to whatever limb had to be chopped off, and they would chop it off, and the limb would fall out the window. And they didn't change knives or wash them or anything, right? So I think Joseph Lister thought maybe, since it was so close to that carnage, that there would be maybe a little bit more acceptance, but there wasn't. The first day of the conference, he was blasted by everyone. He didn't even speak, but they took the time to, say what he did was not right. On the second day, he spent 2.5 hours laying out his whole system, probably thinking about it. He still was blasted. So he got on a train and he went out to San Francisco, visited places all along the way, and had varying levels of response. But by the time he got back to Boston, this guy, Dr. Bigelow, said he didn't know that there were really any germs, but he was very impressed with how dedicated that Dr. Lister was to his patients and to his process, and decided that Massachusetts General would now do this, which was huge, because you get Massachusetts General, then pretty soon you're going to get other facilities that are, the old places. All right, just so you know, he didn't just put carbolic acid, wash out wounds with it in surgery or put it on the dressing. He also sprayed the air with it. And he did that with Queen Victoria. And actually, the person who was spraying the carbolic acid actually accidentally sprayed Queen Victoria, but she was so enamored with the whole process that she didn't mind. He sprayed her face, in other words.
I do have a question now. Exactly what is carbolic acid?
It's a substance. It's called a phenol, and it's been around. I mean, they've been using it for years. It's actually based out of coal tar, so it has a coal tar smell to it, and it's a liquid. It's a liquid form, and the way he used it, so he would wash out the wound with it.
Well, did it bother her face when she got sprayed?
It didn't. No.
That's hard to believe.
No. I think it's more if it stays on your skin, because that's what he had with that 11-year-old boy. It was because he had the dressing on it, and he had that, he didn't
And
change
did
it for a
irritate
couple of
because it was
days,
that long.
and it was a long time. So I think that was it. Well, then after that, he basically, he was so well known by this time. Queen, she thought he was great. Everybody thought he was great. Who was anybody important? When somebody famous who was the head of surgery died in London at his old medical school, they reached out to him. Now, there was some competition for the head job there, and he wouldn't go without some guarantees, because nobody in London believed any of this stuff. So you'd think, it's kind of odd, because you think London would be a place where they would, and a place like Edinburgh, which is a much smaller place, would not. But because he did his work in Edinburgh and Glasgow, he developed the true believers up there, and so he needed some stipulations before he'd come. And he finally did. But he had a lot of work over the next decade to really, I think part of the problem is London had a more fragmented medical community because of its size, so he had a lot of work that he had to do. His wife died in 1892, and after that he retired. I think he still did some research, but he didn't see patients anymore. He got so many awards. Now, one of the things that is interesting to note is he could not go to Cambridge or Oxford because he was Quaker. You had a religious test, and the Quakers didn't pass the religious test, so he was not able to be a student there for his medical training. But once he became famous, he got honorary degrees. So, plus by then he, converted, so. He got all kinds of prizes. He was knighted, had a baronet, and then he became a baron after that. He had, he founded a medical research body that they called the Lister Institute of Preventive Medicine. He got an Order of Merit. One of his favorites was that the King of Denmark actually gave him a Grand Cross, and he thought that was great. I don't know why, but so. And then, I don't know that you can see these, but I stole these from Wikipedia, since Wikipedia stole from that book. I thought I could steal these pictures. They're just some of the things that you can see. One of my favorites I'll show you, but this is in Vienna. They have a plaque commemorating Joseph Lister, Vienna, Austria. This is where he actually lived when he was in London. They have a plaque, Lori Lister. They have various places in London, but one of my favorites is this, in Rome, on the hospital. You know, everything in Rome has those frieze things, and they show him operating on the frieze. In Rome, I think that's pretty cool, to be honest. I mean, not too many people get to be on a frieze in Rome. Okay, so how does this, carry on from here? Actually, because of, I think, the germ theory becoming prominent, and also the whole sewage incident, the Great Stink, the Victorians have started to become more preoccupied with cleanliness. And in fact, at this time, just happen to know this, not through medicine, but they got more into putting tiles in their homes and stuff because they could more easily clean them. And they also could mass produce tiles at this point, which they hadn't been able to do before. So they became really enamored with this cleanliness thing. And all kinds of carbolic acid products came out, hygiene products came out, because they realized things needed to be clean. Listerine was actually developed by an American doctor, Dr. Joseph Lawrence. He actually heard Dr. Lister speak when he came through on his training thing, and was so excited about it, he developed his own formula. And his formula actually didn't use phenol directly, but it used another version of it, thymol. And it had 27% alcohol in it. And some pharmacists bought the rights to it and marketed it. Now, when they originally marketed it, they marketed it, as you can see, for dandruff, floor cleaning, and a cure for gonorrhea. So, but now it's a mouthwash. In 1895 is when they decided that it was a mouthwash. So it's old. It's older than I realized. And now, Joseph Lister had nothing to do with it. He didn't know about it or anything, but this was a direct result of this doctor hearing him talk about germs, and we need to get rid of germs. So this was his response. They even had carbolic toothpaste. Can't imagine that tastes very good. But the Queen loved it, so there you have it. Then, I think this is a riot. Some pharmacist in Iowa made a folk rag, carbolic acid rag, which he composed in 1901. I just feel like this a little bit crazy. The other thing that you would know about is Johnson & Johnson came out of this. Because Robert Wood Johnson attended that Congress in Philadelphia, and he was so impressed by it that he got his brothers involved, and that's when they put together the Johnson & Johnson company to basically do bandaging, sterile bandages. So that's how Johnson, I didn't really know that until I read, this this book, so. But the most important thing is that the germ theory was accepted. And that really has changed the whole landscape of medicine. As you know, I mean, yes, we had to have antibiotics and stuff, but the fact is, they did surgeries with no antibiotics. Once they had this antiseptic technique, people were living and not dying of infection and not requiring amputations. I mean, we still have amputations today, but it's much narrower indications for it now. You know, it's not usually because of you fell, you broke a limb, because usually we can keep infection out of the limb now. So I think that was a successful story. So these are my conclusions. You can tell me if you have any others. First of all, Joseph Lister was really a warrior because he was relentless in his pursuit of pus and infection and for people to be dying. I mean, it's not a good feeling when you're supposed to be taking care of people and they die. In those days, they probably were more accepting of it than we are, but I don't think he particularly enjoyed it, for sure. And I think he was really the right person at the right time because he was a very humble guy, and he had the persistence and the drive, and he had the education and sort of the science bent that not everybody did. Not every surgeon was as scientifically oriented as he was as far as looking at everything, collecting data, and so he was just really at the
Did he ever get over his stuttering?
He did, but he still had some issue with it if he was under pressure. And one of the things he was worried about when he was doing the Latin thing was that he would stutter through that because of the pressure he was under, since he didn't know about it, and he had to put together this speech really in spur of the moment.
It looks like he did a lot of speaking.
He
as
did.
He got over it, so
He did.
sounds like maybe.
He got over it enough that it didn't really bother him to do that, and his students loved listening.
Well, that's what it
And,
sounds
you know,
like.
he would have lecture classes, and then the next semester, more students would sign up because they heard how good he was. You know, the typical thing with a good professor. So, and then, you know, my conclusion is that because of Joseph Lister, you can have surgery and not have to worry about, I mean, yes, there's always a risk of infection, but you can say, do I want to have this surgery because I'll feel better when my gallbladder's out? You won't be saying, well, what is my risk of infection? Do I have a 60% chance of it being infected, and do I want to take that risk or not? We don't think like that anymore, you know? So he really changed the landscape for us.
Do they ever use carbolic acid for anything to do?
That's
No.
what I was gonna ask.
No.
And this been 3 or 4 years ago, during the pandemic, you know, staying home. I
Yeah.
saw this movie on payor,
Oh, yeah.
on Turner Classic Movies, and it's just excellent.
Oh, yeah.
And I think it attributes his interest in this germ theory from the number of women that died in childbirth.
Oh, yes. There was actually an Austrian physician who, Semmelweis was his name, who during this time, there were issues with women who died, they call it puerperal infection, which is infection around the time of childbirth, or right after, you know. Actually, you know, Thomas Jefferson's wife died of that, actually. It took her a long time, but she did. So,
Did her child die?
yeah, she had a lot of issues with childbirth. Anyway, so this physician was convinced that infection was the reason, and there were some organic bug causing it. And he had things he put into place. He was an OBGYN and put in place in Austria. And he was very interested in Lister's work because of his work treating women after childbirth. So, yeah.
Well, I know in the movies, whenever someone was having a baby, they always said, get some hot water.
Yeah,
And I always wondered what it was for, until I saw the Pasteur movie.
yeah. Yeah. No, he was in it, well, and the other thing that is interesting is that Pasteur and Koch, they didn't like each other at all. They didn't get along at all. Initially they did, but then, you know, Koch, I don't know if it's because one was French, the other was German, but Koch would say, well, you're not even a doctor, because Pasteur was a scientist, he wasn't an MD, and Koch was an MD, and, you know, so they were always having arguments about stuff. But Lister wasn't involved in any of that, so.
Well, what caused him to try that in the first place? I mean, did he just have some laying around and decide, let's pour some of this on it and see if it works, or?
Well, he was kind of known as something that would get rid of the stench of sewage, and so he really postulated that this would work to kill whatever the germs was. Now, you remember, he didn't know there were moldable germs.
Yeah.
He only knew there were germs. Okay, so he didn't care what the germs were. Unlike Koch, who was looking to say, oh, this germ causes this disease, this germ causes this disease. Lister was just trying to get rid of an infection in general, whatever he could do. So he just,
And he knew
he
that
just tried it. He tried this potassium permanganate, which is another thing, this kind of caustic, and he thought that might work, but it didn't really work. I think because he had to dilute it enough that it just didn't kill.
And he knew the infection had that same smell to it.
Yeah.
It was like a,
Yeah,
so, okay.
yeah, infection smells, if you know. And one of the things that, that the patients even noticed once this went into effect, if a patient had to go back to the hospital for any reason, they noticed the difference in his wards, after he had put this into place, because there wasn't the same smell on the floor. You know, the great hospital stink, the good old hospital stink.
Yeah.
What did
It
the
wasn't
smell
there.
of ether?
No, because, no, not on the floor. It wouldn't have, it just smelled of infection, you know. No, but they didn't change their aprons. They wore aprons, and they thought that their surgical aprons, the stiffer they were with blood and pus and stuff, the better they were. And it showed that they were, you know, working surgeons, like hard-working, you know, surgeons. So, you know, it's a whole different world from what we're used to.
Yeah.
That's why I started off saying, well, what do you expect? When you go, well, we don't expect that, you know, at all. We're so used
Well,
to
think
it.
about the time relative to the Civil War.
Yeah, I
How
know.
many amputations there were in the field during that war?
Well, and if you read any of their accounts of the Civil War hospitals, and especially in the South, they didn't have the supplies. The North, it wasn't that much better in the North, but they had more nurses, more doctors. They had more supplies, so they were able to give more treatment to those guys. The South, they were really in a bad way. Remember that in the Civil War, 2/3 of the casualties were due to disease. So that's, I mean, you think, well, what were the casualties related to? Well, they got killed by bullets, no, they didn't. 2/3 of them got killed by disease, and it was childhood diseases, measles, you know, things that we all get vaccinated for now. They didn't have vaccines for that, so they all got close to each other, not good hygiene in the tanks, sewage, because they didn't necessarily deal with their sewage correctly. So it was difficult. to say the least. Cholera, that was a big one. Don't want to die of dysentery. It's a nasty disease. Yeah.
Listeria?
Yeah, and that's named after him, Listeria.
I thought it might be.
Listeria is named after him, a bacteria is named after him. He wasn't involved in naming it, but it was like, it's an honor that they give to, people who've been important. He actually, on the 100th anniversary of the year that he operated on that 11-year-old kid, they had stamps, they issued stamps.
Oh,
Yeah, the village did, yeah, commemorating that event. So, because that was really the turning point for him, you know, about, because he had to have a successful surgery in order to prove his theory. So, yeah. I mean, 6 weeks and 2 days, but he walked out
that was
on his
amazing.
own leg.
But otherwise wouldn't have died.
Yes. Or, well, he had an amputation for sure. And, you know, his thought process on that was that, okay, this is an 11-year-old, I should amputate. That is the standard. But this is an 11-year-old, what's his job prospects going to be? What is he going to be able to do with one leg? So he decided that this was the guy that he was going to try it on, and thank the Lord it worked, you know, for that kid. So, anyway. Well, that's all I had.
Well, thank you for coming, Lori. It's a wonderful talk, and you ushered the rain in. It is pouring down.
Is it?
I was wondering what that sound was.
I can feel a cool breeze just blowing through here.
Pouring down rain, okay.
So y'all, go get a cookie